Why are we being told, and have been, that they are estrogen supplements and HRT are so dangerous when they're not?
Because of everything else that we've been told, right? So just like, eat Dunkin' Donuts and have a coffee and it'll get you going. Okay. Can I stand?
Yeah, stand.
I'm a stander. Okay. I walk, I stand, I walk. So, just with hormones. So how many people are here from 30 to 40? Wow, no one's 30 to 40, but you, okay, there you go. Why did you go like that? You should be like, yeah. Okay, so I'm just gonna do a little bit because, just in time from 30 to 40, 40 to 50, and so on, right? So hormonal changes, and aging starts the day you're born. And the gut has a lot to do with aging. Our gut ages, and we have to take care of the aging gut with really good things like Mediterranean diet. I use a lot of colostrum in my practice to heal the gut. Mother's milk, let's breastfeed our gut, right? And live a great, healthy life. So it always starts from the gut because you need to have balance in your nutrients first in order for hormones to work. Whether they're your natural hormones or whether you're compounding with Tom to get your compound hormones, which that's what I love to do. And I've been doing it, believe it or not, since 1998, when it wasn't even in this country. A French woman came into my office and she said, Dr. Carfora, you do bioidentical? I said, what's bioidentical? She goes, oh, I can't get it anywhere. So she got me in touch with four people that were in California that were just starting an anti-aging movement. So I went to classes. They weren't even classes, so on and so forth. Then they became classes, a board certification in 2004. So moving to present day today. So just bioidentical hormones are compounded according to your individual needs. If you have lupus, you have a gut issue, you have high testosterone, you have low testosterone, it's geared towards what your body needs, okay? So changes in hormones from 20 to 30, your hormones do start to change. Remember, my grandmother used to say every 7 years your hormones change. So 7, 14, 21, right? In the Greeks too, right? It's every 7 years, 7 years. And 7's supposed to be a lucky number. Yeah, right.
Yeah, right.
Really. So when you get into 20 and 30, depending upon your stressors, like I said, I'm seeing a lot of PCOS. So disease hits this country. That COVID attacked what's called the fusion protein in the uterus, and it is making changes in our young daughters. And I'm like on this mission to save our daughters, okay? Because we're seeing a lot of this, yes. And we have to help them. So when you're connected with your, and this is high testosterone. So, and again, I used to see one PCOS person a year. I'm seeing 10 a week. This is no joke. I reported it. This is no joke. This is like, so that's number one. So we have to get these women that are younger, 20 to 30, check their hormones. Make sure they don't have estrogen toxicity. You mentioned the MTHFR gene. 80% of us sitting here have that gene in one form or another, and it affects estrogen metabolism. So your estrogen goes up. So in your 20s and 30s, that estrogen is high. You get heavy bleeding. You start to develop fibroid uteruses, fibrocystic breasts. If we could catch people early, check their MTHFR gene, treat the metabolism of estrogen and hormones, correct the gut, do all of these things, we can save you. So now from 30 to 40, because that's when you're in 30 to 40, your hormones, depending upon your stress also, 35 to 45, progesterone drops. Now, progesterone is your calming, relaxing hormone, right? It gives you your zen. So from 35 to 45, often people go, I have palpitations, I can't sleep, I'm anxious, what's going on here? It's because your progesterone is low. Now, and I go like this, right? So here's estrogen, here's progesterone. It's supposed to be nice and even for all of us. Well, here my elbow's the stress factor, right? So here's estrogen, progesterone. Now you get stressed. What happens? Your progesterone's way down here. So what's hanging out? Your estrogen. Now, if you're in an MTHFR, that estrogen will attack your breasts, will attack your uterus. You will be through hell from 35 to 45. And that's when we see breast cancer. We want to get people before this happens, right? And with anyone with breast cancer, and you ask a history, like 4 to 5 years prior to that breast cancer happening, it was because it was a stressful event. And their progesterone went way down like that. So again, we need to prevent this, and we need to start early. And again, start with the pharmacist, because the pharmacist now, especially a pharmacist like Tom, you know, he understands hormones, he understands cortisol, he understands skin. He's a biochemist, right? So you could talk to him about, hey, you know, I have vaginal dryness, I have hot flushes, or you could talk to your wife about all that kind of stuff. But anyway, so 35 to 45, you're at that age, right? So you're dropping progesterone naturally. Now you're in an age that you're, you know, getting a job and you're hustling and you're planning marriage and you're having babies and all this stuff. So it becomes very important. Now from 45 to 55, now this starts to drop. So estrogen and progesterone start to decline. That's when your hot flashes come, right? Your vaginal dryness, your palpitations, your anxiety. And I call it the itchy, witchy, bitchy. You just go, get the hell out of my way. And it's true. And it's so, you know, like I say, you know, when you ever like go into a store and like,
Imagine if I said that.
I always say, like, a woman coming in, like, to a store and, like, she slams the door behind you. Well, I go, you know, come and see me. Here's my card. You need progesterone, right? So you need progesterone. We got to calm you down, right? So, again, that's that itchy, witchy, bitchy. And, like, you could throw things. You could act out. And for whatever reason, the curse words come in between. When you start to go through menopause, you start to say words that, I mean... I just yelled at my husband before I came out. I'm way postmenopausal. But anyway, so, you know, and those are the things like that if you recognize them or your family recognizes them, they say, Ma, what's wrong? Ma, why are you tired? Ma, why are you moping around the house? This is all hormonal changes. So again, you need your estrogen, your progesterone balanced. Now the question with breast cancer. Breast cancer is the imbalance of hormones. It's not estrogen, it's progesterone, it's stress, and it's an MTHFR gene. So you could balance that, you could reduce your risk factors, unless you have a BRCA gene. So that's a whole nother story. But, you know, you could reduce your risk factors. And again, you know, eating well, you know, making sure, and with brain, the gut-brain connection, really important. Because also when you go through hormone changes, your serotonin starts to drop. So if you have the drop in estrogen, now you're 55, drop of estrogen, drop of progesterone, testosterone down in the toilet. Talked about recurrent urinary tract infections. You know, you get dry down below, your pH changes, so you're gonna get recurrent urinary tract infections. And why wouldn't you use something down there to pH balance and protect yourself and give yourself, you know, other things? So don't fear hormones. Hormones are our friends. And they're our friends for men, women, and also your daughters, okay? And your sons. Because sons go through, I've never seen such low testosterone in our young boys, ever. Like Tom will have a higher testosterone level than a 22-year-old that comes in my office. I've never seen that either. So, and that has a lot to do with dietary, stress, you know, getting the Mediterranean diet in there, absorption. You know, on my journey with COVID, because again, COVID changed a lot of people's hormones and immune system. I wrote Stress, Gut, and Immunity. It was a book that I wrote and I politically couldn't talk about like COVID. And then I wrote Ageless Gut, the inside story. And that takes you from your gut, from absorption, from getting all your nutrients into your brain, your amino acids and all of that, to produce your neurotransmitters, and then takes it to the cell, your hormone balance, what you should do, what you shouldn't do. And, you know, to just basically, you know, have the help, you know, don't suffer with perimenopause, don't suffer with menopause, don't suffer with post anything, you know, and really we just have to be more proactive at an earlier age and talk about it.